Hardy Diagnostics HardyVAL media-filled test kits are recommended for routine use in the monitoring of aseptic procedures used in compounding sterile preparations. The kit contains the necessary materials for one pharmacist or technician to perform the media-fill challenge testing as specified in USP Chapter 797. HardyVAL low-complexity media-fill test kit contains 1 100 ml vial of Tryptic soy broth, 3 empty sterile 20 ml vials, 1 Whirl-Pack bag, a results log sheet, and instructions for use. When performing media fill risk challenges, use procedures and techniques that most closely resemble those used during routine compounding of CSPs. If necessary, the following procedure may be modified to include more complex manipulations. Once begun, the test is completed without interruption. Label the empty sterile 20 ml vials with the date challenge is performed and the initials of the person performing the procedure. Remove the tamper-evident seal caps. After removing the caps, clean the septum ports with a sterile 70% isopropyl alcohol wipe. Within an ISO Class 5 air quality environment, using the same sterile 10 ml syringe and vented needle, transfer 4 5 ml aliquots of sterile Tryptic soy broth into the separate empty vials. Total volume in each vial will be 20 mLs. Apply sterile adhesive seals aseptically to the rubber closures once the vials have been sealed. Carefully place the vials in the provided Whirl-Pack bag for transport to the incubator. A convenient write-on area on the bag may be used to identify the technician and the date of the test. Incubate the samples at 20 to 25 or 30 to 35 degrees Celsius for a minimum of 14 days. If 2 temperatures are used for incubation, incubate the samples for at least 7 days at each temperature. Examine the samples every few days for the presence of turbidity or growth of bacteria. Growth may not be evenly dispersed throughout the vial. Tap or swirl the vial to observe for growth that may have settled at the bottom. If growth is observed, the vial may be discarded. Do not continue to incubate for the full 14 days. Visible growth or turbidity seen on or before 14 days of incubation is a positive test for the presence of bacteria. The media fill challenge test has failed and indicates that a non-sterile technique was used during the test. No growth or turbidity observed in 14 days indicates the media fill challenge test was successful, and technique used during the media fill challenge test was aseptic. Record results on the results log sheet. Discard all used syringes, needles, and completed test files as biomedical waste.